Coming up on Healthy Living, thinking about a new you in 2011, learn about plastic surgery options available in the Northland, plus some less invasive options for turning back the clock, including light and laser therapies that target troubles like age spots and rosacea, and some relaxing ways to treat yourself while giving that dry winter skin a boost.
Your health questions answered. Welcome to Healthy Living, brought to you by the experts at Essentia Health.
Welcome to another edition of Healthy Living. I'm Kim Kaiser, filling in for Michelle Lee tonight. Are you looking to make some changes in 2011? This is the time of year when we might be thinking about reinventing ourselves or taking new steps to look and feel our best. There are many options you may not realize are available through the plastic surgery department at Essentia Health. We begin our show by welcoming plastic surgeon Dr. Matthias Solomon and physician assistant Rebecca Lewis. Now, thank you both for being here tonight. I sure appreciate it.
You're welcome.
Thank you. Well, Dr. Solomon, let's start by talking about what are some of the cosmetic procedures that are available through your office?
I offer a full spectrum of cosmetic procedures through the SMDC Essentia Health system. Essentially anything from office work like Botox or fillers to the whole spectrum of breast procedures, lifts, reductions, augmentations, and facial procedures for the aging face like blepharoplasties, upper and lower lids, facelifts, brow lifts, and a whole lot of other things.
So there are all sorts of things to keep you busy,
Yep.
I'm sure. Now, what are some of the really popular procedures that you find patients are coming to you and asking you for, Rebecca?
Well, what we're seeing recently is Botox and fillers, and also we've had consultations for breast augmentations. Tummy tucks are quite popular as well.
All things that people are thinking, that sounds like it might be a good idea.
Mm-hmm.
Now, there are a lot of different thoughts about cosmetic procedures. Do you think that attitudes are starting to change, or more people maybe admitting that they had something done or thinking about having a cosmetic procedure?
I think certainly a lot of people are thinking about it, because essentially cosmetic in the real world is not the kind of cosmetic you would come across in Hollywood or elsewhere. In the real world, you're looking at somebody who's had kids, who's a little out of shape, has a lot of excess skin, maybe over the belly, and they don't feel like they were 5 years ago, for example, and they just want to feel normal. They want to fit in clothes again. They want to look nice to themselves and have a sense of fulfillment in their life. And I think that's kind of that's most of the patients I see, really.
Do you think patients are talking about that they had procedures done, or are people still keeping that pretty private?
That, I think, depends on the part of the country. People are a little conservative here. I would say it's a 50-50.
Sure.
Yeah.
No, that makes sense. There are probably a lot of people who are thinking, oh, this is kind of interesting to me, or I might like more information. What should someone do if they have questions about whether they might be a candidate for a cosmetic procedure?
Well, give us a call. We have our staff is very knowledgeable as well, but they're able to make an appointment with Dr. Solomon for the initial consultation. The patient comes in. They discuss, what the patient's expectations are, what the surgeon's, expectations are as well. If they're interested, they give us a call back, and from there we can move forward and schedule the surgery, schedule the procedure.
I'm sure it's very, very informative. And one patient thought she had to live with an unsightly scar until she learned about the plastic surgery options available at Essentia Health in Duluth. Now she says she is so pleased with the results and is sharing her story. Enjoying time with her pets in her Duluth home, Carrie Lane says her memories of a life-threatening experience 5 years ago seem far away.
I had, a few years back, a medical emergency and needed emergency surgery. And so at that time, when they did my incision, they weren't thinking about beauty. They were thinking about saving my life.
Because the incision from her abdominal surgery healed poorly, she had a very visible and uncomfortable reminder on her body of that difficult time.
Every day I would see it and think about that surgery and about that time, and actually after that time in my life, after a very near-death experience, it really changed my attitude about being alive, so it was hard every day to see that near death when I'm really trying to be alive, if that makes any sense.
A friend recommended she talk to a plastic surgeon, something Carrie had not considered.
She said, no, you should go see Dr. Solomon because he's really good, and just talk to him. He might be able to give you some ideas. They look you in the eye and they talk to you like they're listening, and you're a person. And Dr. Solomon told me all the options of what he could do, different ways he could do this, and gave me choices about which way we would go with it.
This surgical experience was very different from her previous emergency. Carrie says she felt well cared for. Anytime
I had any concern at all after the surgery, I was just like right away, oh, come on in, we'll check you out. And it was just a different experience. So the scar being gone was part of the healing, but for me, the really good care was also healing. Basically what he did is moved it. So it's now a horizontal bikini line incision instead of an up and down vertical incision.
And while she doesn't plan on showing off her new stomach, she feels better about her body.
Dr. Solomon did a good job, and I'm just really happy, and it's really nice because now when I look down, after a shower, I see a normal stomach. I don't see this other stomach that I had that really didn't feel like my stomach either.
Now she can focus on what's really important, spending time with her loved ones.
He's just got great bedside manner, and so does Rebecca. But no, I absolutely think we're lucky. I like him a lot, and I would never hesitate to recommend him.